A charity is warning that public health could be at risk because GP surgeries are refusing to register asylum seekers. Doctors of the World says almost 40% of patients it's had to register had been turned away. Harriet Hadfield has this exclusive report.
This is a clinic for patients who can't or won't get medical help anywhere else. And many end up here because they've been wrongly turned away from a local GP surgery.
How are you today?
Sanjeevan, a Sri Lankan asylum seeker, was refused registration. He's made the 4-hour round trip to be seen by a GP from Doctors of the World.
I was very worried. I had so much pain and really needed help. I showed my asylum letter, but they said they couldn't register me because the letter had no address.
His doctor Jenny is a volunteer who works 4 days a month at the clinic.
These are vulnerable people who need to be able to register with a GP, who need to access the healthcare. So we need to be flexible and find a way to get them registered.
NHS guidelines say all asylum seekers and refugees are eligible to register with a GP practice. Last year, Doctors of the World made 849 registration attempts between March and October. 39% were refused by the practices in red, most of them in London. Reasons include 39% with no ID, 36% no proof of address, while 13% specifically because of immigration status. According to the Royal College of GPs, the problem is more about paperwork than discrimination.
I don't think GPs are sitting in their consulting rooms thinking, let's block care to refugees. I think it's the complexity of what's going on in reception, and I think our receptionists need support. I think this is a difficult role.
Most of the people we've met here at the clinic don't want to appear on camera. Many are afraid it could damage their claim for asylum or they could be sent home, and it's that same fear that prevents many other people from seeking any kind of medical treatment at all.
Dr. Al Story is an expert in tuberculosis, so from his point of view, the situation poses a real risk to public health.
Well, if people get turned away from primary care and they're symptomatic and they could have tuberculosis, the consequences of that are transmission in the community. It's in all our interest to diagnose TB early and ensure that people can access diagnostic services.
Would you mind telling me a bit about the background, a bit about how you came to the UK and things?
Doctors of the World have helped Sanjeevan sign up with his local surgery, but GPs across England are under pressure to ensure frontline staff understand exactly what the rules are and register all eligible patients. Harriet Hadfield, Sky News, East London.